But keeping our pets on a vaccination schedule can help protect them from dangerous diseases. Joining us are Karla and Stephanie from the Greater Edmonton Animal Rescue Society with a little guest named Fizz. Good morning, ladies.
Good morning.
Okay, so Karla, you've been housing Fizz and his siblings. Tell us about his story.
Sure. So Fizz and his 5 siblings, so there's 6 of them in total, came into our care in mid-July from a community a couple hours north of Edmonton. So we have 6 little puppies. They're about 3.5 months old now, all very sweet, looking for, foster to adopt. So very soon will be posted for adoption. So good little puppers.
He seems like such a sweetheart. Is he crate trained? Is he potty trained? Where are we at?
Working on potty training. Haven't done too much in terms of crate training just because I'm home with them most of the time, but puppies tend to pick that up quite often. But yeah, very good temperament, good with other dogs, likely good with cats, would be good with kids. So they're pretty easygoing pups. Yeah, and they all came into care and were very quickly fell ill. They all ended up getting sick with parvo, but they all came through.
And typically the survival rate is quite low with parvo, and so they're miracle siblings, which is great. Let's talk about parvo. What is it, and how do they contract it?
So parvo is a highly contagious intestinal virus. You're most at risk if you are unvaccinated dog or puppy, and especially our senior dogs can catch it quite easily. It can live on surfaces for up to a year, so cleaning is of the utmost importance. These guys are so lucky because it can be a very hard disease. Usually, you'll get symptoms within a couple days of exposure, and they were, I believe, about 12 days, which is like the end of the exposure range.
Okay, what are the symptoms? What are some early signs?
So like lethargy, they'll become quite lethargic. It affects the intestine, so then they end up having, vomiting, diarrhea, which causes a lot of dehydration, which is kind of one of the key risks for pups if they don't get medical care, is the dehydration tends to get a lot of them. So these guys Fizz was actually hospitalized for a night. The rest of them all just received medication, anti-nausea, antibiotics, and then sub-Q fluids just to make sure that they don't get dehydrated. And after 3 or 4 days, it tends to work through the system, but if without medical intervention in those 3 to 4 days, it can be quite deadly.
Well, parvo does not sound like a ton of fun at all, which is all the more reason to keep our pets vaccinated. So how important is it to keep a vaccination schedule?
It is very important, and that's one of the reasons why it's also important to make sure you're not bringing your puppy to places like dog parks or kennels before they have their vaccines, because it can be so contagious. So young puppies tend to get 3 rounds at about 8 weeks, about 12, and then about 16. And then once they've had all 3, they're fully vaccinated. And it includes parvo, distemper, rabies, and a couple other things that they get protected from.
Yeah, for sure. Okay, so let's just keep gushing on Fizz. Why would he make a good fit for a family, especially with kids?
He's just so sweet. He's the smallest of the litter, so he's probably not going to be huge.
Okay.
And he's got just like a little goofy little personality, like he was kind of pawing earlier.
Seems like he likes to cuddle. We were cuddling a little bit in the green room. Yeah.
Very curious and just kind of pretty easygoing and chill. Like nothing really phases him too bad, but he's still a puppy, so he's still got some puppy tendencies.
For sure. But seems like he's very treat motivated, as they all are at this age,
Yes.
and beyond. Ladies, thank you so much for joining us this morning. Hopefully Fizz finds a new home. Please visit albertaanimalrescue.org for more information and to check out upcoming events and fundraisers.